This chapter covers aphasia, memory loss, and cognitive syndromes caused by focal brain disease. In the following videos, you'll see some examples of Wernicke's aphasia caused by stroke, primary progressive aphasia and its variants, and amnesia caused by Alzheimer's disease.
Wernicke's aphasia is one of many different types of aphasia. It is most often caused by stroke. Its hallmark is an auditory comprehension deficit, a severe auditory comprehension deficit, so much so that patients have great difficulty understanding single words, sentences. They also have trouble monitoring their own verbal output, so they are not aware of the errors they're making in their own speech. So consequently, they speak very fast, very fluently, but the content of their speech is often devoid of true meaning. They may be using words, nonsense words, substitutions, semantic paraphasias, literal paraphasias, and this is opposed to Broca's type of patient who can convey meaning by their ability to use nouns and verbs. Wernicke's patient is the type that will go on, and you may not be able to understand much of what they say. The lesion associated with Wernicke's aphasia is typically in the left temporal lobe. It is a large, deep lesion affecting the underlying white matter. The deficits associated with Wernicke's aphasia are due primarily to damage in the middle temporal gyrus. Here we'll take a look at a patient with Wernicke's aphasia. He had a stroke about 10 years ago, and from this sample we'll see some of the hallmarks of the disorder using tests that are classically used from aphasia batteries. So we'll look at his naming deficit, auditory comprehension, repetition deficit, and spontaneous speech, which is very revealing of what a typical patient with Wernicke's aphasia sounds like.
How often do you play golf?
Well, I usually driving my office because I has a schedule so I can play golf or just visiting and talk to my friends and my wife.
So here we can see that a patient with Wernicke's aphasia understands the gist of a question. He knows that the question is about golf, he likes to play golf, he talks about golf, but he didn't understand the exact question. How often do you play golf? And he's unable to give an exact answer to that question. But you'll hear in his sentences content words that make sense given the context.
We had a friend of mine was playing with me, and that was a long ways. And he was a brother.
So you can also see, as he's talking, that he's substituting a related word for a target word, a semantic paraphasia. So for example, he initially is talking about a friend who plays golf and then calls him his brother. So it's in the ballpark, but it's not exactly who he's talking about.
What's that called?
You have a key,
No?
pencil,
Pretty close.
key.
What would you do with it? Show me what you would do with it. How do you use this?
Working pencil.
Yeah?
Working. You have a good working pencil. A pen, P-E-N, is
Excellent.
better.
You got it. You got it. Terrific. You like that one better, huh?
Pencil.
All right. How about these? What do you call
Oh,
those?
you can have driving your picture, your camera
Yeah?
activity.
Yeah? What do you call those? What's the name of this?
Pencil. Navy picture.
Does anybody
Movie.
else Does anybody else have some of these?